Hello, my name is Rosetta Edom, and I'm with the crew.
My name is Jamal Gonzalez, and I'm also with the crew.
Hi, my name is Haley Masters, and I'm with the crew.
My name is Latoya Willis, and I'm with the crew.
Hello, my name is Rodney Walker, and I'm also with the crew.
We decided to do an article about racial and ethnic disparities, and a little overview of this article is basically there are common psychiatric and behavior problems that are ignored in children and young adults, which causes individuals to go without care until they're taken to jail or prison, and then they're given treatment there. To reduce the criminal behavior in youth, there were conducted surveys to assist the triggers of mental health issues to decrease the results of youth experiencing legal authorities. In order to determine the factors of these triggers, there were different conducted studies. There's also a statistical analysis to determine whether or not these disparities reflect racial or ethical differences, along with certain factors such as mental health impairment, poverty, health insurance coverage, or other demographic factors. There's also statistical analysis as well. Now we're talking about the social research to determine these factors. There was qualitative data that was taken. There were different qualitative data used to evaluate the medical care of non-institutionalized civilian population of the U.S. versus the institutionalized population. Things that were used was like a nominal level, for example, like the medical exponential panel survey, which is also known as MEPS. It examined the use of mental health services, and by using the services on a normal, they were able to examine different services when individuals come in for inpatient stays, emergency visits, outpatient mental health visits at offices, along with clinics, hospitals, outpatients, and departments and emergency departments. They also use the ordeal level and more of the level as well. Now we'll move on to Jamal.
Hey guys, my name's Jamal. So we're participants randomly assigned in this national study represented data from 2006 to 12. The students or the affectees was caused to young adults. This sampling is of non-institutionalized civilians in the United States. Restricted analysis for children under age 18 years and young adults 18 through 34 were used to create these samples for numbers. How this took place: examining per 1,000 persons and per capita expenditures, rating of perceived mental health statuses by doctors on a 5-point scale. They all broke it down in the sections of insurance status from private to public coverage. Then there's a video here that breaks down how this sampling took place and how this data was analyzed.
Recall that a population refers to the group of things that we want information about, and a sample refers to part of the population that we take out to examine and draw conclusions from. In this video, we will be looking at the different methods of obtaining a sample. But first, let's look at the types of biased samples. Biased samples occur when one or more parts of the population are favored over others. The two types of biased samples include the convenience sample and the voluntary response sample. A convenience sample only includes people who are easy to reach. If this is our population and a researcher comes along to interview people, then he would only talk to the people that are closer to him to be part of the sample. This is a biased sampling method because not everyone in the population has an equal chance of being part of the sample. Only people that are of convenience to the researcher will be interviewed. Now, a voluntary response sample consists of people that have chosen to include themselves in the sample. So the researcher lets people come to him. This is a biased sampling method because people with a strong interest for the survey topic are the ones who are most likely to respond, whereas the people who don't feel as strongly about the topic may not even care to respond. Remember that a good sample is one that is representative of the entire population, and it gives each thing an equal chance of being chosen. When you have these conditions, you have what is known as an unbiased sample. We will be looking at 3 different types: stratified random sampling, multi-stage sampling, and simple random sampling. The most basic type of sampling is the simple random sample, also known as an SRS. Since an SRS is unbiased, each individual has an equal chance of being chosen to be surveyed. In other words, to be part of the sample. You can think of an SRS as putting names into a hat and selecting N of them. So if I wanted a sample size of 6, I would select 6 papers and come up to the randomly chosen people to interview them. For a stratified random sample, we take the population and we divide it into something called a strata. Strata refers to the groups of similar people. Within each stratum, we take an SRS and combine the SRSs to get the full sample. For example, we could take an SRS of 2 people from each group so that we get the total of 6 people. A stratified random sample is good for making sure that whoever is administering the sample gets in contact with each kind of group. The last type of sampling is called multi-stage sampling. For multi-stage sampling, we use a combination of 2 or more simple random samples. As the name suggests, multi-stage sampling means you have to go through different stages to find where your sample comes from. For example, if we have 3 groups, stage 1 could be selecting which group will be picked using an SRS. Let's say that I picked out group 1. Then that means I would only look at group 1. Then for stage 2, I would do another SRS to get the 6 random people. We go through different stages of simple random samples to get the actual sample, and this is why this is called multi-stage sampling. I'd like to point out that instead of putting names in a hat, there's another way to pick things randomly. We can use something called the random digits table. The random digits table consists of a long string of random numbers, and it can help us do an SRS. To use it, I would first have to label each member of the population with a number. We have 30 people in this population, so I will label each person from 1 to 30. Notice how I have written 0, 1 instead of just 1. Doing this helps us use the random digits table. Since each label has 2 digits, we will read the string of numbers 2 digits at a time. So let's say I want a sample size of 4. We will use the random digits table to randomly select 4 people. The first number on the table is 19, so person 19 will be part of the sample. The second number is 22, so person 22 will be part of the sample. The third number is 39, but our sample size doesn't go up to 39, so we will ignore it. We will also ignore 50 and 34, but we will keep number 5. We will also ignore 75, 62, and 87, but we will keep number 13. As a result, these are the people we would survey.
And then we'll take it over to Haley Masters.
Thank you. Okay, so the sample size in this study. Basically, this study used nominal and ratio data that was collected in the MEPS survey, the Medical Expenditure Panel Survey. That survey took place between 2006 and 2012, and the sample size that was used was 1,000 children who were classified under the age of 18 and 1,000 young adults, which ranged from the ages of 18 to 34. So basically what happened was this data was collected from that survey and then tabulated and analyzed to gain a better understanding of the use of and the cost for mental health care across different racial groups. In order to examine the disparities, the following controls were used. So basically they calculated demographic differences such as age, gender, and location. Then mental health impairment. They used a 5-point scale ranging from poor, fair, good, very good, and excellent. And this information was collected for the children and parent response to a survey called the Columbia Impairment Scale, where the parents basically, you know, rated their children's mental health on that scale, and it was self-reported in the young adults. Insurance status, so whether or not they had private health insurance, public health insurance, or whether they were uninsured, and their income level for their household according to the federal poverty limits. And so those were classified as poor, so less than 100% of the federal poverty limit, near poor, 100 to 124% of the federal poverty limit, low income, 125 to 199% of the federal poverty limit, middle income, 200 to 399% of the federal poverty limit, and high income, which would be over 399% of that federal poverty limit. And next up we have Latoria.
My section talked about substance abuse services and different barriers to the mental health care. There were different studies that were completed that showed Latino children, Black children, and young adults who received less mental health and substance abuse assistance than those who were considered non-minority. The study showed that different substance abuse rates measured for Blacks and whites were similar, but they were still significantly low. And then the social stigma and healthcare system mistrust are just some of the reasons that the book showed why minorities are reluctant to receive mental health services. In the actual article, it was discussing the different minority groups, Blacks and Latinos, and how they are actually, they are not necessarily denied mental health services, but they don't receive the actual help that they need. And one of the reasons is because of some of the areas that they live in. Some of those areas, there's a shortage of healthcare providers. And then there's a shortage of substance abuse providers as well who would actually treat these minorities. So they don't get access to the actual help that they need in reference to someone who's considered a non-minority. When it comes to the different behavior statistics of minority children with mental health issues, Blacks and Hispanics account for approximately 63% of overall children that are in juvenile facilities. The Black children actually experience more school discipline like detention, suspension, and expulsion starting at preschool ages than any other minority group. Like for non-minority children involved in incidents, they may receive a sentence of treatment where minority children may get more criminal charges for their sentence with the same offense. Also in that sample, that population sample, most of the minorities that the study actually tested, they experienced criminal justice involvement. By the age of 23, 49% of all Black men had been arrested. Treatment rates were also low for all groups, but minority youth received more punishment and less treatment for substance abuse. An incarcerated individual may also have mental issues before going to prison, but prison also enhanced some of those mental issues even after the individual was released. So the prisons actually became what they consider mental institutions for people who had mental issues before they actually even went to prison. And now we'll hand it over to Rodney.
Okay, thank you, Ms. Latoria. My overall thinking and my overall understanding about this article is that we as minorities, Black and Latinos, we are, how should I say, prone to not going to visit doctors for mental issues or physical issues. And if you look at the information that I'm showing on the screen right now, you will see the percentages are very, very low when it comes to doctor visits and mental health issues. This key thing about this article is that the information that's gathered is actually sent from the participant. And it could be true and it may not be true. The only issue that I have about this article is that some of the information may not be factual information, but it's a snapshot of Latino, Black mental health visits. And we are the ones that are actually failing to go and visit the actual doctor or visit a mental institute to get the help that we need. So I think we definitely need to bring awareness to this article and bring awareness to our community to let people know that, hey, we definitely need to get out there and definitely get that mental issue resolved and not just put it under the rug. And I know in our community, we just sweep it under the rug, but we definitely need to bring it up And we definitely need to be talking about it within our communities. But I want to ask the group, like, what do you all think about this article? Like, was it interesting, or was it something that you learned from this article?
I think the article was very interesting to see the different statistics with minorities and what they actually lack as far as mental health, where their mental health comes into play, and what services are out there that some of them can't even take advantage of because of issues beyond their control. And like you said, we don't go to the doctors enough. Some people are afraid to go to mental
Yes.
health places and whatnot because of what they've been taught in the past and whatnot. So people, that's one of the things that they lack. They just go without getting the help that they need. So this article does bring light to a lot of that. And I think it was very interesting read.
Yes, I do agree with you. And I'm so glad that you said that they may not have it in their neighborhoods, right? And it may not be, they can't get to it, or some kind of issue that's saying that, hey, we don't have it in our neighborhood and we just can't have, we can't afford that. But now we definitely have these, how should I say, technologies that allow people to connect together, like Zoom, like these interface or online and things of that nature. But I really, really like that you said that we may not have the, how should I say, the facilities in the neighborhood to make these things happen. But what else? What else do you all see in this article? What stands out to you all?
So I found it interesting how the numbers declined steadily from the children having access and use of the mental health care to the young adults. And I found that, you know, in a big sense, I wonder how much of that is due to maybe being outside of like a school setting, or, you know, having, whether it be parents, teachers, principals, whatever that looks like, right, that's pushing them in that direction to receive mental health care. And then, you know, once they're on their own, what stops them, right? Like, is it financial, which, you know, like we can see by the numbers that, you know, I mean, in that age range, a lot of young adults are either losing, you know, losing access to Medicare, Medicaid because they're aging out, or they're losing access to their parents' health care because they're aging out of it. And then, so then what's left for them, right? And then also just looking at the difference, and, you know, not only the use of it, but also the quality of access to this mental health care, because,
Mhm.
I mean, we're looking at, you know, Medicaid, you know, public versus private insurance, the quality of access to that care is very different, you know? And so, in one hand, it's like, of course, they should still, if needed, try to utilize that care. But if they're not getting the help that they need when they get it from these providers, then I feel like a lot of, you know, children, their parents, and young adults are going to stop trying if they're not receiving adequate care.
Yeah, I totally agree with that. That's very important. The very important is like utilizing the tools, and if those tools are, it's definitely right for that person, right? Because if it's not, they're just going to, like you said, they're going to get out of that system. They're going to just stop trying. They're just going to stop trying to better their mental health. I really, really love that. The quality of the actual services that they're offering is very, very important. That's really, really important. Yes. What else?
It also brought light to the actual people who go to providers. They may not go to a counselor or a psychiatrist or someone like that who specializes in the actual mental health field. They may go to their primary care physician. And a lot of times, like the article is saying, going to the primary care physician, they've been misdiagnosed or
Mhm.
underdiagnosed because of the fact that they don't have they may have Medicaid or something that doesn't allow them to go to the specialized service where they need to go, or they may not have the actual um, health insurance through that will pay for them to go. So they'll go to their primary care physician to get diagnosed. And a lot of the times they're not diagnosed correctly. So a
Yes.
lot of them have these mental issues and they've never been diagnosed with the mental issue. So they're walking around not even knowing that they have it because they haven't taken the step further to go to actually be tested with someone who's licensed.
Yes, yes, and that brings a valid point as well. So in this class, think about like statistics, right? Think about all of those numbers, like Tori just said, like all those people are misdiagnosed with the wrong illness, right? And they're just walking around thinking that, you know, they have something or they don't have anything, and just all these numbers are just in my head, and I just really feel sorry for the system, and I really sorry for the people that are involved as well. So that's very, very, very important. The misdiagnosis and all of those numbers and looking at that statistics. But a couple more things, like what's something different? What's something else that stood out to you all?
I mean, I know about the incarceration part. Like, I feel like it would be better if we were more aware of numbers and like the determining factors instead of waiting to the last minute to where like, oh, they seek medical treatment after they gotten in trouble and committed a crime, maybe something like that. Like, by knowing that the different triggers that causes individuals or the youth to be in a situation to where they have to go to a juvenile detention center in order to get treatment. I feel like if they're aware before that happens, like their life probably would be a whole lot better. And
Yeah,
they would
you're right.
have for that.
Yeah, I totally agree with that. Like I'm actually, I don't want to put this plug in here, but I'm actually doing a documentary about mental health, about addiction and the triggers and the patterns, right? That's very, very important, because if you don't understand the triggers and if you don't understand the patterns of these addictions that keep you in the cycle, then, you know, what's the point? That tells me that the system is not working for you, or the treatment is not working for you. And you're just going and going and going and going and do that same thing over and over and over. Statistically, looking at those numbers, it's truly amazing looking at those numbers and learning everything in this class and just understanding statistically is just really, truly amazing. I truly understand that. But that's a good point as well. Yes, breaking that cycle, or I call it breaking that generational curse. Yes. Okay, but anybody else?
The more we educate ourselves, the less likely we are to repeat these cycles.
Yes, you're so
That's
right
good.
about that. Yes, I truly agree with that, Jamal.
But putting this in a concrete form where people can see percentages and equations and ups and downs on graphs, it better visuals for folks to actually do something about it.
Yeah, you're right. And you brought up a good point. And so we're in this class, right? So we're learning about all these graphs and we're learning about all these numbers and calculations. I feel that when we follow these calculations, there can be truth within this, right? So you don't go outside of that. So if you go outside of that, we can't really validate it. But if everybody talks the same language and they speak the same communication and code, then yes, it definitely will bring light and it will bring a valid point and it will bring a change to it as well. So I totally agree with that as well. Yes. But with that said, I guess we can stop it here and we are good to go. What do you all feel about it?